Okay, so perhaps I should start off by thanking you, Jose, for agreeing to be interviewed for this patient-related program. And just to introduce myself, I'm Professor Tariq Mughal. I'm a professor of hematology and oncology based in London, Denver, and now also Sils Maria. Perhaps you could start off, Jose, by just giving me a 30-second snapshot on what you remember from the time just before you were diagnosed with leukemia.
Well, I was feeling great until a certain point. I was working in Paris, and I felt bad enough to go to the doctor, to the American hospital, to have to tell the doctor, look, I don't know, I don't feel too good, I have problems with the tooth. Try to make me a quick checkup, etc., etc. But it was not a quick checkup, unfortunately. And after 2 days, after some tests, I was diagnosed for having a lymphoblastic leukemia, acute lymphoblastic leukemia. And well, from the very first moment, the doctors, they were talking about possibilities, percentage of success. And
do you remember those percentages?
Well, apparently we're a little bit lower than people told me, you know. No, it was struggling a lot at that time.
Yeah.
But from the first moment, the doctors, they are telling you that there is a possibility. I thought, well, this is my possibility, and I have to try to fight with determination, no?
Right.
To try to win the battle. And I was extremely fortunate that I had, of course, a family that supported me a lot. I was in the hands of a great medical scientific team.
Right.
In Barcelona, later
Absolutely.
on in Seattle, in the United States, and also for this wave. I can use this word wave of affection and solidarity from people, you know, that gave me an extra strength to fight, for sure.
But more specifically, do you remember the percentage of probability the doctors were giving you in terms of survival? Because, you know, would it be fair to say that they said something like 30-35% at that time? Or was it a little bit more optimistic?
No, maybe a little bit less optimistic. So I was thinking, because, you know, being from the South, we are always trying to be clever than the others. No, I thought if the doctors tell me 25, 30, that means that probably is 15, 20. And but in any case, well, I consider myself a very fortunate person.
Absolutely, yeah. I mean, that's very important. And you're very right. I think even if you're not from the South, even if you're from the North, many patients would cut the figures we give them by half, you know. And I think it would be fair to say that at that time, you know, acute lymphoblastic leukemia, as you know in detail, is a very rare leukemia which affects children, which adults. It's a very common leukemia for children. And in children, remarkably, we were able to successfully treat at least 80-85% of them.
Which is great.
And most of them are cured. But in adults, it used to be 25-30% of the adults only. And but remarkably, if you fast track now to just a decade ago, a lot of important changes have taken place, you know. And my own research has been in a small molecule which was used to try and block off the transcription which happened in the cancer cell, which leads to the final development of the leukemia. And this drug, you know, one of the first drugs, which is known as imatinib, in Europe we call it Gleevec. It's spelled slightly differently in the US. And this went on to revolutionize the treatment of a leukemia called chronic myeloid leukemia, which is not, of course, not what you had, but there's a related lymphoblastic component to that, which it also helped, you know. And it's progress like that which has resulted in more changes. And now we have another very rare form of blood disorders called myelofibrosis, which also transforms into an acute
I
leukemia.
see.
And you'll be interested to know that, just this week on Monday, two companies which are co-marketing the product, Novartis and Incyte, just released the important data that this may change how patients are treated. Do you remember, if you go back to when you actually had the treatment, the chemotherapy treatment, and then the stem cell transplant, how your quality of life and also your professional life in terms of singing was changed?
Well, I had to stop completely my profession, and I was staying in hospital for almost 9 months.
In Seattle? Huh?
3 months in Barcelona to get into remission,
Yeah.
just chemotherapy until
Was that
getting
the
into
Hebron
remission.
Hospital? Or
I beg your pardon?
was that the Hebron Hospital in Barcelona?
No, it was at hospital clinic.
Hospital clinic?
Yeah,
Uh-huh.
with Professor Rothman. And then I was advised to go to Seattle for the autologous bone marrow transplant. And then I was there almost 5 months. And the quality of life was poor, I have to say.
Were you able to take your family members with you?
Yes, thanks God for this. Yes. I took my family, and they, needless to say, they have been extremely supportive, and that was a very, very, very important aspect.
Yeah. And then thereafter, how soon were you able to get back to your professional activities?
Well, I was released from hospital in Seattle at the end of February, 88, by the way, and I was recovering slowly, not only physically but also mentally. I start feeling stronger, and I've been very lucky because toward the end of July of the same year, 88, I was able to give my first concert.
Excellent. Yeah. We as doctors sometimes worry when we treat people from your profession, because some of the therapeutic modalities we use to condition the patient for transplant, whether it's autologous or allogeneic, can affect the pitch of the voice, because it affects so did you feel that you were able to sing with the same kind of pitch as you were singing before, or was there a modification?
No, I think that at the beginning my muscles were not trained, because we sing with the muscles. The diaphragm, vocal cords are muscles as well. So the muscles were probably needed to be trained again and work a lot on that. But I think that basically my voice was more or less the same, and thanks God for the pitch was also good.
Excellent.
And I know that my doctors, both in Barcelona and Seattle, have been very careful also with my ears, giving the right dose.
Absolutely. That's very, very important, And I think it was very fortunate too when you look back, because Seattle probably is considered to be one of the world's #1 place for transplant, both autologous and allogeneic, and it remains so, Then in the last 2 decades, you have been very instrumental as the president of the Jose Carrera Foundation in a lot of important patient advocacy groups, meetings, and other exercises. How important do you think is for us doctors to involve patients in the discussions for the treatments, in the research parts, and so on?
Well, I can imagine that is the opinion, the point of view of any patient is good for the scientific community, because from every patient is a world by itself, and you learn things from them, I'm sure, even if you have wonderful skills and great knowledge. But I think every patient gives you the possibility to see maybe a new aspect, no? So therefore I think it's great, this encounter together with the patients.
Yeah. And do you feel that if you remember your own upbringing, when you were a child and you looked at illnesses and so on, have you seen a really important revolution taking place in the way doctors deal with patients at all levels, in terms of discussing diseases and treatment plans and the partnership?
For sure, nowadays, things they change a lot. I mean, when I was a child, 50 years ago, I think doctors did not give many explanations to patients. But I think that doctors, they are sensitive enough to talk to the patient in a different way, depending on the the mentality, the sensitivity, the social status of the patient, the cultural level, etc., etc. Right. I think this is also a part of a psychological work for together with the patient. No?
Absolutely. So I just want to take 1 minute in terms of the first of all, words would not satisfy enough to tell you how I felt when you agreed to write the foreword. Okay, thank you very, very much. Of the first edition in 2006, and then the second edition, which was last year. And I'm particularly interested to hear from you now. Let me just put my glasses on. Where in your last paragraph, where you talk about, and let me paraphrase, finally, let me share with you, that's the reader, what I recall as being the fundamental source of strength in my recovery. Even if there is only a small chance of survival, the particular chance is yours and the one you fight for. I think this is so important, and repeatedly when I speak at different patient advocacy groups and other patient-related endeavors, this is the thing which makes my patients drive a lot of strength. And we were particularly grateful that you were able to share this particular sentiment with us. These series of books have been very well received, and we hope they will be continuing to be well received. They're, of course, non-profit organization. And you may have noticed, I usually start the book with a poem, and in the last one, we stole a particular poem from W.B. Yeats, which is "He Wishes for the Clothes of Heaven," which he wrote in 1899. And this was dedicated to my late father and my late mother-in-law. My late mother-in-law, sadly, we lost in her early 40s from a similar problem. So I know you have a very, very busy schedule, so I'm very grateful that you gave us some time to share this, and we will use this recording to try and drive other patient-related programs. And I hope you continue to support our patient education endeavors in the future as well. And perhaps, if time permits, even partake in a live patient audience forum. And we're trying to organize one here in Sovreta House, perhaps in December this year. And I will reach your team to see, and this will be a small half an hour, 45 minutes exchange, where I can present some of the more advances in the treatment and so on. But most importantly, the message from the leukemia world is that, the 2 decades ago, the prognosis for acute lymphoblastic leukemia in adults was dismal. Okay, you were very smart in halving the prognosis which was given to you by the doctors, and it was the realistic number was probably somewhere between 15 and 25%. But today, realistically, at least for some of the subset, for example, there's one which is known as the Philadelphia positive acute lymphoblastic leukemia, we have improved from 10 to 15% to about 50-55%, enormous improvement. And I think with these kind of exercises, with support from yourself, support from the foundation which you have helped create, we hope to improve the treatment outcome for patients for many years to come.
We are all fighting for the same purpose.
Yeah. Thank you very much.
Thank you, sir.
Thank you.